Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of histology on the topic GIT Histology. So let's start.
Welcome to the histology examination. We will be focusing on the gastrointestinal tract. To begin, can you describe the distinctive features of the mucosal lining of the esophagus, particularly its epithelial layer?
The esophagus has stratified squamous non-keratinized uh, layer whose function is protection from abrasion, particularly food bolus. But the stomach has simple columnar epithelium and its entire surface is lined by mucus secreting cells.
That's right. The stratified squamous epithelium serves well for protection. Now, considering the stomach's simple columnar epithelium, what is the microanatomical basis for its mucus secreting cells and why is the secretion crucial for acid protection? Please be advised, this kind of information does not constitute medical advice or a diagnosis. For any health concerns, you should always see a healthcare professional or seek care.
The gastric mucosa is lined by simple columnar epithelium of surface mucus cells, which invaginates into gastric pits, opening into simple branched tubular gastric glands within the lamina propria. Surface mucus cells secrete bicarbonate rich mucus. Mucus neck cells secrete a thinner acidic mucus. Rugae are mucosal and submucosal folds. All of these protect the stomach lining from acid.
Excellent breakdown of the protective mechanisms. You mentioned rugae as folds. Are these present continuously throughout the stomach or do they change with the distension of the organ? And how do these folds compare to structures in the small intestine like the plicae circularis?
Uh, the rugae are present throughout the gastric mucosa.
Not quite throughout. Rugae are prominent in the body and fundus of the stomach and are typically less marked in the pyloric region. Importantly, they flatten out when the stomach distends, increasing surface area for expansion. Now, contrasting this with the plicae circularis of the small intestine, how do these permanent folds contribute to its primary function of absorption?
Um, can you please explain this?
Certainly. The plicae circularis, unlike rugae, are permanent folds of both the mucosa and submucosa. They significantly increase the surface area for absorption throughout the small intestine, and they do not flatten out when the bowel is full. This structural arrangement, along with superposed villi and microvilli, maximizes the area available for nutrient uptake. Does that make sense?
Yes.
Good. Now, continuing with the small intestine, how does the density of goblet cells change as you progress from the duodenum to the ileum? And what is the functional reason for this gradient?
Uh, the density of goblet cells decreases as we go from duodenum to the ileum because most of the nutrient absorption occurs in duodenum and as we
You've got the
progress.
gradient right, but the reasoning is slightly different. Goblet cell density actually increases from duodenum to ileum. This is because as you move down the tract, the contents become more solid and more mucus is needed for lubrication and protecting the mucosa from friction rather than being directly related to absorption. Does that clarify things?
Yes. Thank you.
You're welcome. Let's discuss the large intestine now.